Disclaimer alert.
Dr. Salem, Doctor of Physical Therapy from Brooklyn, New York. I have an interesting case today with a shoulder pain. Today we're going to do the exam. We did already the neural tension tests, all were positive. She has a severe positive neural tension tests, all of them, the radial, the ulnar, the median nerves. This is beyond the scope of the video because I already done. I'm going to see my patient sign. She has severe positive Addison sign, and she asked me what is that. I told you before, guys, if you see the other videos on my YouTube channel, Cure Within Your Hands, we spoke about Addison sign. And I graded Addison sign in my 5th DVD. And I graded to severe, moderate, and mild. And what is Addison sign? Addison is the name of the doctor who discovered this sign. And why is it so important? Addison would check the pulse, and the pulse is not there. And why we check it? I suggest for my people who watch me, and I do with all my patients, anybody come to my office with a shoulder pain or a neck pain, should check the pulse first.
Right.
Okay, why? Because the pulse I can palpate, I can detect, but the nerve I cannot detect easily. You can feel it, the numbness, the tingling, the pain.
Yeah.
But if you want to know the nerve, you check the pulse. Why? Because the nerve, the artery, and the veins is travel together. It's something called the neurovascular bundle, one bundle. And they travel between one big muscle called the scalene. So what is scalene? The scalene is a muscle that comes on the side of your neck on both sides. One is scalene here, left or right. And the scalene, let's say, is like the deltoid. The deltoid muscle is this muscle.
Yeah.
It has anterior deltoid, middle deltoid, posterior deltoid. The scalene is the same. It has anterior scalene, middle scalene, posterior scalene. It's like that.
Right.
The scalene attaches from down to the first rib.
Right.
And the first rib is like this. It moves something called puppet handle motion. Puppet handle like this. So the scalene hold the first rib from the middle, like that, and it lifts the left first rib up, like puppet handle, to increase the vertical dimension of the chest, to increase the air. So mainly scalene is accessory respiratory muscle. It's supposed to work only if you are competing and running and climbing the stairs or swimming.
Right.
It's not supposed to work when you're resting at all, when you're supposed to be relaxed. But with the life stresses, work and family and tension here and there, we appreciate your effort as working mother and daughter and family and stuff. So something called, we have two systems. We have the autonomic nervous system has two parts. One called the sympathetic and one called the parasympathetic. Sympathetic is a fight, is a flight, is the one make you ready. It's the one who works during the day.
Right.
You run, you fight and flight. And parasympathetic is supposed to work at night. We sleep and rest, digest food, the club, empty the urine, empty the bowel, empty the stomach, like that. Sometimes when the sympathetic is overactive all the time, so the scalene going to spasm, and it stays spasming all the time. So pull the first rib up and keep it up all the time. And let's speak now about the scalene. The neurovascular bundle, back to the neurovascular bundle, it travels between the anterior scalene and middle scalene. When the scalene spasms, it squeezes first between the anterior and middle scalene. Squeeze the neurovascular bundle. Not only that, sometimes the neurovascular bundle passes between the anterior and middle scalene. After that, it passes under the collarbone. It is the collarbone, and the first rib is here. So the neurovascular bundle, the artery, the nerve, the vein, travel together after passing between the anterior and middle scalene, under the collarbone, and above the first rib. So if the scalene pulling the first rib up, it squishes, it compresses the neurovascular bundle again between the two bones, the first rib and the collarbone. So now we check the pulse, I check it in here, it's not there, it's called severe. Because what is not severe? It's not severe if you check here is there, and if I take it behind your back and I check, and I see it is not there, it's called moderate. I take your hair, pulse it there, move your hand behind your back and it's not there, it's called moderate. Okay, if I take it behind your back and it's still there, and only move your neck down this side or this side, move your neck up, and it stops. It's called mild because only your neck, your hand is behind your back, and it only stops when you move your hand. How I treat that is very simple. The first thing we need to do, we need to relax the scalene muscle, because if you squeeze between the anterior scalene and middle scalene, and we relax the scalene muscle, the pressure going away, most likely the pulse will come back.
Right.
How we do that, there's many ways to relax the scalene. The best way, which I like to do the best way, is a way that was found 120 years ago. Dr. Lawrence Jones has made a lot of research. He had 50 years of research, and many doctors after him did researches. It's called the counter stroke, which is said that we shorten the muscle. If you shorten the muscle, make it too short, the muscle gonna relax. Because the muscle is spasms, if the muscle keeps strained for a long time, it's gonna spasm, it feels gonna tear, to protect the teeth, gonna spasm. So when you shorten the muscle, it means like you're relaxing the muscle. You shorten it, make it short, so it relaxes. Muscle for a period long enough, the muscle will be assured. Muscle has memory.
Right.
We should believe that, because if you don't believe the muscle has memory, how come you believe that the chip card in the phone has memory? A phone has memory. Metal, you have a muscle. Muscle has memory too. So when you assure the muscle that no more strain, the muscle will relax and your pulse come right away.
Okay.
95% of my patients get this the first visit. The other 5% they get better within 4 visits.
Right.
Okay. First, we're going to shorten the muscle. Most likely, the pulse will come. If we shorten the muscle, the pulse didn't come. So most likely the rib is stuck up, and we have to push the rib, push it down with the hand, push it down with the hand, and just press. The first rib is very short. It's here, it runs in here. As you see, scalene here was the breast was tender. When I push it, it was tender. He was hurting, and I feel it here. And this is the first rib here. If I push, sometimes I put a tennis ball here and push it and stretch your neck. So push the first rib down, the pulse will come back again.
Right.
Okay, this is gonna work. This is gonna get first thing we're gonna treat now is, and I suggest everybody watching me to do this first. If the pulse is not there, we need the pulse to go there. Why?
Right.
Because no pulse is no blood. No blood is no regeneration. It's gonna be degeneration. If you have injury, you have something in there, the blood need to go with the nutrients, with the oxygen for the tissues and cells to work properly. If no blood, no enough oxygen, no enough blood, you're gonna be only wear and tear, no building, only destruction, which is not good. We need to get the blood to go there first for the healing, for the nerve to heal. After we get the blood there, so we're gonna take care of you have the nerves, you let it squished in there. We're gonna mobilize the nerve, flossing. The nerves are very strong. So after you cook them, you cannot even bite with your teeth because they're very strong. So just when you mobilize the nerve, you floss it the same way you floss your teeth. The nerve will make space for itself because it's too strong. The only problem with the nerve lies, the nerve mobilization is the nerve. Sorry if you put your finger here and move it fast. Try to do this. Right. You're gonna feel like heat and something, but it's not good. Same when you mobilize the nerve between the tissues, create for itself. The nerve had a sheath. The same way if you don't work all the winter in your garden, and now with spring you come out to work with the garden and all the tools, your skin get like inflamed, they get some blisters. 1 week you keep working, this will be done. We're gonna give you suffering for 1 week. After that, the skin will be strong and you can hold the tools and gardening tools and work on the problem. Same with the nerve. First 5 visits, first week or 2, maybe the nerve get inflamed, give you more pain. It doesn't mean the treatment is not working. The treatment is working, but we have to go through this. Same way you have to go work in the garden to be able to work. You have to go through this layer. Your skin gets better. The same with the nerve, mobilize it, make the sheath to get stronger, to be able the nerve mobilize it and make space for itself. The nerve is very strong. We're going to start treatment now. Do you have any questions before we start?
No.
I'm going to start treatment now.
Great.
Do you mind staying in the film while doing this? It's okay?
It's okay.
Sure. I'm going to put the zero here, the left shoulder. And I'm going to cover you. Give me a big towel. You have Mercedes, please. Lie down here, sweetie. Oh, sorry. Are you okay?
Yes, I'm good. Okay.
So this is your left shoulder. Okay, the way you do counter strain for the screen. Just relax, please. Leave it for me completely. Leave it for me completely. I want to shorten the muscle. I'm going to take your head to my side very slow and like just relax. This works 100% for people who can relax. And this is a passive technique. Here,
I'll try to.
you relax, I do all the work.
Okay.
If you something hurting, just raise the other hand. If you want to speak, raise the other hand, and you're going to get this hurting. I'm going to push this up and hold this here. And I can use my leg to push here and keep my hand in
If
there.
I can take the pain, I won't say anything.
You have the pain?
If I can take the
yeah,
pain, I
sure.
won't say. If it's
Sure.
sharp, I'll say so.
Okay. How is any pain now?
Okay, a little bit.
Where?
Here.
Shoulder? Okay. I'm going to take it. Let me check the pulse. Yes, congratulations. Pulse is there and strong. I told you 95% of my patients come right away. Okay, this is counter strain Lawrence Jones. This got better within less than 30 seconds, guys. Okay? Okay, that was good. Okay, now pulse is here. And this was the screen spasm. And you check now here, gonna be no pain as before. Still hurts you better here.
No, better.
Better, yes?
Better,
See, this
yeah.
was hurting before a lot, yes?
Yes.
So now we got the screen spasm off, and you're lucky, the pulse is there now.
Okay.
This number one in the step. Okay. The second step when you should take care of it. We did the exam today, something called the Euromaster Technique. Yeah, yes. We did the, I'll just cover my patients. If it's too hot, speak up, okay?
Yes.
If it's too hot, let me know. If it's too hot, you like it?
Okay. Yeah, I like it.
Okay. So, I'm gonna do the neuromobilization. I did this, guys, in a previous video, how I treat the neck pain, and I did the neuromobilization. Just go look how I treat neck pain. I explained all the neuromobilization before. Now I did something called the Neuromuscular Technique exam. I examined my patient, which is tender. She had tenderness over the upper trapezius, over the levator scapulae, over the latissimus dorsi, over here in the low back. Latissimus dorsi come from here, guys. And I wanted my young doctors to know that the main muscle that keeps the humeral head in its place in the glenoid is the latissimus dorsi. So we need to release the latissimus dorsi. But I want to tell you guys, we have tender points in the muscles. We have tenderness over the scalene, which got better, over the upper trapezius, over the levator scapulae, over the latissimus dorsi. This called, I want to know what those are secondaries or primaries. I checked the upper traps and the subscapularis. Please do this with every patient you have with a shoulder pain. I pulled the arm out and I checked, and the subscapularis was very tender. It was a primary. If I treat the primary, the secondary is going to surrender. Now I'm going to treat the subscapularis now, and we're going to film after that. I'm going to treat subscapularis, give them patient privacy. I'm going to treat subscapularis muscle. After that, this is the primary. Going to patient going to feel better. Tenderness will be better on shat tenderness and upper traps, and the latissimus is going to get better as well. Thank you.
The cream.
Don't wash it yet. This is okay. After we examined, we found that the primary tender point is the subscapularis. This is how I treat the subscapularis. As I said, I can do it with my hand just by rubbing deep friction with my hand on the subscapularis. It's going to be gone, God willing. But I use the ultrasound. It's much more effective, and I prefer it if you can use if you can, get some local anesthetic like brilocaine or lidocaine, 25%. This is going to help with long-lasting effect and going to be easier on the patient. So I'm doing it now with the ultrasound, the phonophoresis, and ultrasound going to give me the neuromuscular technique effect as if I do with my hand, and at the same time, lidocaine or brilocaine will be giving also help enhance muscle relaxation and help alleviate the pain. I tell my patient don't wash it, like leave it for 12 hours minimum if you can. And this is, how is the pain now here? Getting better?
Yeah, a little bit.
So it's better or is it still the same when I press?
A little better.
Little better, okay.
Yeah.
We do this for 5 minutes. I have only like around 25 seconds. How is it now here when I do this? Still pain?
No.
It's better, no pain now, yeah?
Better.
Yeah, it's better. Okay, guys, this takes 5 minutes and the pain will be gone. If you treat this subscapularis, trust me, the upper traps get better as well. The latissimus dorsi get better as well. As I explained to you before, guys, the muscles works in a group. What happened if subscapularis, pulls the counterpart, try to balance. So the levator will ball, the upper traps will ball to counterpart. So if you relax the primary, the first one who's spasmed, which is a subscapularis, how you find out which one is a primary or secondary? If you find so many tender points in the patients, what you do, the body can feel only one pain at a time. There is a 2 points at the same time, and there's a 2 points at the same time. The one he can feel it, this is the one the primary. It's superior to the one that he couldn't feel it. And keep filtering them to come only to 1 point. Okay, it's done, Mercedes. Thank you. If I press here, Molly, still hurts or no? To be the truth. When I'm pressing now with the machine in this area.
No.
No pain.
No.
So now after 5 minutes, guys, the subscapularis now is no pain. Let me check the upper traps now. This here, the upper traps, is better now.
Yeah.
Still hurts or better?
Yeah, better.
Better.
Yeah.
So
No
we
pain.
treat subscapularis, upper traps got better. Okay. Thank you for watching. Press like, subscribe if it's first time, leave your comments, share it with your friends, and stay tuned for more videos coming up. Bye now.